Hello and welcome. My name is James Martinez. I'm the admissions counselor for the University of Houston College of Pharmacy. And today we are working on a project where it's an interview series with faculty and staff in regards to why they chose the University of Houston College of Pharmacy. And joining me today is our Executive Associate Dean, Dr. Pitman.
Good morning, James. Good morning, everybody.
Good morning. And so what we want to do is just ask you a few short questions and really get your perspective on and you have a unique perspective because you were a student at U of H, as well as you've taught and you are an administrator now. So you really have a unique perspective and insight on the program. And we really want to convey that today. So Dr. Pitman, if you would, tell us a little bit about yourself, how you got into pharmacy and why you chose the University of Houston.
So I grew up in the Beaumont area, which is about 2 hours east of Houston. And I knew from a younger age that I always wanted to go into the medical field. I just quite didn't know where was that going to land. My mother was a x-ray technician. She also did mammograms. She did a lot of the radiological testing. And so she was my inspiration. And because of her, that's really what prompted me to want to go into the medical field. We had some family friends that were pharmacists. I had the opportunity to shadow with them in their pharmacies and in some of the hospitals that they worked in. And so I think I was about 60% on going into pharmacy when I entered college, which was really great. I spent my first couple of years at Lamar University in Beaumont, and then applied to the University of Houston College of Pharmacy and got accepted. For me, graduating from UH College of Pharmacy, I actually got a bachelor's degree. So it was a little bit before the PharmD was available within our school. After I graduated, I worked in hospital pharmacy for a few hospitals in Galveston, along with in the Texas Medical Center. And then I decided to come work for U of H because I really enjoyed the students that I was interacting with as a pharmacist. And I really wanted to be on the environment of a college campus. I thought that was a fun time, and I wanted to spend my work environment there also. I returned back to school twice over the course of my time. My husband and I together got our MBAs from U of H. And then I returned to pharmacy practice, more in an administrative role, moved into a pharmacy manager role, started and finished my PharmD through a different university and graduated, and then came back to UH College of Pharmacy because I really miss that student interaction, and I miss being here. It's a very special place. I feel like it's a unique group of people who care about each other and work together really well. And I really wanted to come back and work here at the college.
That's awesome. And we hear a lot from students as they're applying to the program. They wonder, what is my interaction with other students? What is the faculty interaction like? And you mentioned for you that student interaction is something that you were really drawn to. Can you talk a little bit more about maybe your teaching experience at UHCOP and just the overall involvement with students?
Sure. I think I've been involved in a lot of different aspects of working with students, teaching. I've been with the college for over 20 years, so taught in a lot of different places. Started out working in communications class, teaching that course, also teaching more of the skills lab courses and coordinating those classes to make sure that they ran smoothly. When I came back to U of H, I was involved in the experiential programs. I worked with the hospitals and really placed the students on those rotations and worked with the preceptors and tried to help the preceptors and the students with any of the issues that were going on, really supported the students so they could be the best that they could be on their hospital rotations. My last role before I took on this position was Assistant Dean of Student Services. So I spent a lot of time working with individual students on the issues that they were struggling with during pharmacy school, helping them to find solutions so that they could do the very best they could within the program, graduate, and get the positions that they wanted to get upon graduation. So that was a really fulfilling role.
If you would, can you tell us what stands out about the University of Houston College of Pharmacy?
Absolutely, James. Probably the first and most important thing is we have had the #1 pass rate in the state of Texas for several years. And it's not just been those last 3 years for sure that it's been #1, but we've had a very, very high board pass rate, which is the most important exam a pharmacist takes. It's the one that allows them to practice pharmacy. We've had an extremely high pass rate for at least over the last 15 to 20 years. For the entirety of me being a part of UH College of Pharmacy, our students have done amazingly well on that pass rate. So a large history of students passing that exam at a very high rate, definitely higher than the national average, and many times even up to the 100% mark. Secondly, I feel like our rotations that students are allowed to go on, which generally happen during the last year of a student being within the College of Pharmacy. Those rotations are very unique. We're super fortunate to have the TMC in our backyard. We have great affiliations with every single hospital in the Texas Medical Center. And at those hospitals, the pharmacists really practice at a very higher level. We call it practicing at the top of their license. And in many of those places, pharmacists are doing really high clinical activities. They're working hand in hand with physicians, and they're really leading kind of the practice within the state, if not within the nation. And so our students have the opportunity to do rotations with those folks at MD Anderson, at Methodist Hospital, at St. Luke's, and at many of the other wonderful institutions in the Med Center. Being in Houston, we have very unique pharmacies. We have PCCA, which is the Professional Compounding Centers of America, where students have the opportunity to learn compounding from people in the nation that do it probably the best. So we're super fortunate just to have a lot of facilities and a medical community within Houston that is so top notch that students have truly amazing experiences. We're ranked 31 in the nation, which is very exciting as a College of Pharmacy per US News and World Reports. And a lot of that in part is due to our research. Our research is ranked in I think 22 in the nation right now as well. So we're doing really amazing things here at the College of Pharmacy, but it's our student leaders that I feel like I definitely want to point out. We have an amazing group of students who run for leadership positions and take on leadership positions, not only within our college, but within our state and nation. So we have had, probably over the last 5 years, we probably had 5 or 6 national presidents, national officers of student organizations. So our students are showing their leadership at a very high level. So many exciting things that we have going on here. And there's probably more that I could say that stands out, but I feel like those are probably the most important things that I definitely want folks to know if they're considering UH College of Pharmacy.
Certainly. And the last thing we'll kind of touch on here is what bit of advice would you give to students who are interested in pursuing pharmacy, either on the fence or they're like, hey, I know I want to do pharmacy. What is your advice to them, either for personal, professional development, whatever it might be? What advice do you have for prospective pharmacy students?
I think students thinking about pharmacy school should definitely get to know a pharmacist. That's probably the #1 thing that they can do to really help solidify their decision making in this process, and to get a true picture of what does a pharmacist do. That's really key. I think pre-pharmacy students really need to be mindful of what it takes during pharmacy school to get through the program. And they also need to have some idea of what they might want to do as a pharmacist. The great thing about the profession of pharmacy is there are so many different career options that students have once they graduate. It's very exciting. However, if students don't quite prepare to do those different things and maybe have some experiences while they're in school, then they may be a little bit more limited when they graduate. So spending time getting to know a pharmacist can kind of help them even early on identify some of those areas, and then maybe be a little bit more mindful about experiences they have during pre-pharmacy, during pharmacy school, that'll kind of help propel them into those positions upon graduation. I think the other thing that I would tell pre-pharmacy students is to really learn how to study. That's key for most of the professions. It's not about the same type of studying that they do in college. It's very much really learning how to learn and learning how to focus and teach themselves going forward. And so spending that time during undergrad, really learning how to study, I think is important.
That is really good information. And I know on my end as an admissions counselor, we talk to students a lot about expanding your experience, your volunteer work, your network opportunities, right? Because if it's in a pharmacy, if it's in a healthcare setting, that kind of expands your knowledge and understanding of what the profession is, but also your network, really helping you navigate, the pre-pharmacy process, or once you're in pharmacy school to graduate and things like that. So really getting to know a pharmacist is a great benefit. Well, thank you, Dr. Pitman, for joining us today. Again, for students who are viewing this, feel free to reach out to us. Our contact information will be at the end of this video, as well as in the description box of this video. Continue to reach out to us if you have questions. We are more than happy to assist you, and we will continue to have additional programming much like this video series here on our YouTube page at the University of Houston College of Pharmacy. Thank you.
Thanks, James.